Walking down the street, running into a casualty on the way to the PX or to the store?
Negative, Sergeant.
My name is Sergeant Montgomery, and I am here to inform you on how to properly evaluate a non-responsive casualty.
Cool.
When evaluating a casualty, you're going to check for responsiveness, open airway, breathing, and chest wounds. Identify and control breathing. Check for fractures and check for burns. While walking up to the casualty, you're going to make a quick assessment of the casualty to determine if he's alive or not. While en route to the casualty, you're going to ask the casualty, "Are you okay?" If he does not respond, you ask him again, "Are you okay?" Still does not respond, place your hand on his shoulder, gently shake him, ask him, "Are you okay?" If the casualty does not answer, you're going to check for breathing. Check his airway to see if it's obstructed. Putting your hand on his head and your hand under his chin, do a head tilt, chin lift, and opening in his mouth, looking for any obstructions in the airway. There's no obstruction in the airway, so we know he's good there. To determine if the casualty is breathing properly, you do the touch, feel, and listen by putting your ear over his nose and mouth, looking down his body to see the rise and fall of his chest, like so. He is breathing. Now that we've determined he's breathing, you're going to check for bleeding. Placing your hands under his body, doing the tuck and feel. You're going to look for blood on your hands, placing under the body, pulling out, looking for blood. You're also checking for an exit wound while you're doing this, just in case he has a chest wound. He is not bleeding. So if he was bleeding, you would identify and control bleeding, which he is not. So now you're going to check for broken bones on the body by gently squeezing his arms on both sides and gently squeezing his legs, starting from the furthest part from you inwards to his inner thigh, which I don't want to jump off the stage right now, so I'm going to do that. After you check for broken bones, you're going to check for burn marks. You're not going to be able to see burns on his back, so you're going to have to gently pull the casualty towards you by putting him in the prone position, lifting his leg up, and pulling his arm over his chest so it's easier to pull him over towards you. Checking his back and his bottom for burns. Of course, as we can see, he has no burns. Now, we determined he has no breathing, bleeding, broken bones, or burns on his body. Can anybody tell me what's wrong with this casualty?
Head injury, Sergeant.
Yes. Any questions?
What about shock, Sergeant?
You can't determine shock on a patient if he is unresponsive because you'll be looking for if he was vomiting, pale, and disorientated. Any other questions?
Negative, Sergeant.
Thank you for your time.
Is there an improper way to breathe?